Hello, good afternoon. My comment, I guess, follows along with that, and it relates to the both panel presentations. As Muslims, we believe that Islam is mostly based on the Quran, which is God's words, and prophetic tradition. As such, it follows that many answers to questions of ethics can be found there. And given such a premise, it follows that obtaining sound positions about the areas of bioethics would benefit the West, and the East from these Islamic positions and viewpoints. And they would also serve to help resolve some controversies, vague, varied, circumstantial, or conditional though they may be. I guess my questions are, one, how do we go about presenting the richness of Islam for reference and guidance to answer such circumcision-type questions? And the other is, how do we go about researching, soliciting, and presenting this Islamic information in the current political anti-Sharia environment in the U.S. and in the West in general? I've read, many bioethics books, and the Islamic position to end of life, suffering, abortion is never presented. And I think that it would be not necessarily an accepted position by all, but at least an element for consideration. Thank you.
I have to now, I guess. Well, I don't know very much about the mechanics of how we would go about greater diffusion of Islamic knowledge in an American setting. Two things that come to mind, however, is that I think that among Muslims themselves, there's a need for greater diffusion of just basic Islamic literacy, because I think that oftentimes what happens is people, or particularly Muslims, often fall back on what is sort of culturally acceptable, or what is culturally known, or what simply has the accumulated authority of historical practice in a particular place or time. And that is often taken to be the full expanse of what Islam has to say or to offer on an issue. I think that to the extent that Muslims can become more familiarized with their own tradition, and they can be more effective in bringing others into an understanding of just how rich that tradition is. On another level, however, I think that, your question is quintessentially, in this particular environment, it's political. And I think that, in fact, non-Muslims in America really do have to recognize how much is being lost by the silencing or the intimidation. And lots of that is going on, however surreptitiously it may be taking effect. But the silencing and intimidation of Muslims who are Americans themselves, this is a part of our collective resources. I think the case has to be made for just how much is being lost by not having Muslims in a position where they feel that they can speak up and do so without recrimination. And what's at stake here is not simply the Muslim community, but America itself.
I would like to add to that is there are two other ways also to promote Islamic awareness. One is by cloning Dr. Jackson. He is a wonderful advocate and advocate of Islamic teachings and Islamic civilization. And he's a wonderful professor. We need to encourage our youth also to be enrolling in Islamic studies in major American universities, so they can be in a position where they can teach and promote Islamic awareness in the academic circles or in the public life. Also, I would like to point out that the conference, this particular conference, and I would like to thank Dr. Shanawani, holding these kind of conferences would definitely help promote that cause. This has been long overdue, having a conference like this, Bioethics, Islamic Bioethics, has been long overdue. So I think by having these kind of conferences and seminars, we may be able to achieve that goal as well.
So a couple of more minutes. I'm sure we're going to get through everyone, but Okay, my question is for both Shiite and Sunni Imam. What is the perspective on organ and tissue donation, specifically giving of organs and tissues, and then on the reverse end, being able to receive organs and tissues?
The Shia perspective on that is organ and tissue donation, organ donation in general, is permissible and even encouraged based on two criteria. One, during the life of the donor, the organ has to be internal, not external. So, for example, a person cannot donate one of his two eyes if he is alive, during his life. The other condition is the organ, the life of the donor should not be based on that organ. So, for example, no living person has the right to donate his heart while he's alive, because my life is dependent on my heart. With these two criteria, we realize that other organs are permissible. For example, kidney, which is internal, and one of the kidneys, my life is not dependent on both, rather on one. Afterlife, scholars, Shia scholars believe that with the consent of the deceased, in his written or verbal will, his organs could be donated after his life. In other words, the family members have no right to donate the organs of the deceased. Rather, it has to be with a clear, either verbal or written will of the deceased that he is willing to donate his organs to others. Now, there are some Shia scholars who believe that the recipient should be Muslim, but there are many other Shia scholars who believe that the religion doesn't matter here as long as it is with the will of the donor.
Okay, before we go to the Sunni follow-up question, how would organ donation work if doing a terminal wean is prohibited and brain death is prohibited within Islam? The two types of organ donation are donation after brain death and donation after cardiac death, in which there's typically a planned terminal wean, and if the patient expires within a set time frame, then you can recover organs.
This is one area where Sunni scholars not only tend to differ with our Shi'i colleagues, but we also differ amongst ourselves about whether brain death is a criteria for death or whether the cessation of the pulmonary system is the criteria for death. So there is a difference of opinion amongst the scholars over which criteria we're going to use. If this is for like a research piece that you're doing, I would feel very happy to pull out some information for you so that you have very specific answers. But off the top of my head, I cannot tell you who said each one and give you all of the details because of the difference of opinion. If you allow me, I'd like to add 1 or 2 points to what the Imam said. One thing is that the Sunni scholars pretty much agree with what he detailed. But there's 2 things I'd like to add. One of the things we look at is organs that regenerate. For example, your skin. This is one of those things where we consider it's a much easier case to donate. And another thing we take into consideration is that there cannot be money involved as the incentive for the donation. And the worry here is that without this, it will lead to a gray or black market in organ donation. And so those are some additional criteria that the Sunnis tend to add on that issue.
Okay. And I don't know if there was a response from you about how exactly organ donation would work.
How exactly would it work?
With the patient after brain death or cardiac death from either one of you. I mean, that comes down to, I guess, the practicality of it.
Will you be here tomorrow?
I will, yes.
Since we're going to, I think we're dealing with this particular issue tomorrow, I would prefer to maybe do some research for you tonight, and if I can, I'll try to give you a better answer.
You certainly don't have to, but that would be great. Thank you.
It would be my pleasure.
Assalamu alaikum. First of all, thank you to all our speakers, and thank you, Imam Qazwini, for elaborating on the Shiite position on brain death in detail. Regarding the two other speakers, what is the, I think you commented on the Sunni position on brain death, that it's diverse, there's not one strongest opinion. But in addition to that, what is the position regarding life support, especially in light of maintaining dignity of patient, especially when they're in a position of, again, likely being in a vegetative state, non-recovery, and so on? What is recommended when dealing with the maqasid of the Sharia in terms of maintaining dignity of life over quantity of life?
This is one of the topics we are addressing tomorrow, and I think because of economy of time, it would be best for everyone if we defer that issue until tomorrow.
A practical question from an internist, general medical internist, who has patients in her practice who are Muslim, and that would be if a patient is facing definite predestination with a terminal cancer and is Shiite, would they have the opportunity to choose hospice? And if they did so choose, would their families be allowed to go along with that?
I'm not really well acquainted with what exactly hospice does. What I understand is it is kind of healthcare that they offer at homes. But I guess, you may enlighten me in that, I guess that there is no substantial cure other than just probably the
Comfort care.
Comfort care. Well, Shia scholars believe that the medical staff has to exhaust all means possible, anything within their disposal to save the life of the patient. If hospice does that, then it would be okay to remove him to hospice. If the services offered by hospice does not include exhausting all means of saving the life of the patient.
Does not.
Does not?
No.
Then he should stay at the hospital.
This question for Ms. Ferber about this thing, I think, correct me if I'm wrong, that you mentioned that when a fatwa is given, Mufti cannot be asked to give the reasoning or sources of his information of fatwa. Is that true? And if it is that the case, if a Mufti gives a fatwa and let's say I'm asking a question and I'm not comfortable, and how do I know the soundness of the judgment of the fatwa that he's giving? Like President Reagan used to say, trust but verify. And I like to verify, and as an educated person, that the soundness of the information that he has giving us, it's appropriate and makes sense. And if we just don't do that, don't check it, that as you know, that many young muftis and 25 years old giving fatwas around, it can have a lot of impact, especially if they have no medical knowledge and giving fatwas on the medical issues, which are very critical, and is happening in the practical life.
I may have just misunderstood what you said, but I know that during the presentation I said that a mufti is not required to give it. He is not required to clarify his reasoning. This doesn't mean that he doesn't ever do it, and it also doesn't mean that the mustafti doesn't have an opportunity to ask for that reasoning to be clarified. I know that there's a huge problem right now with muftis giving positions without clarifying the reasoning. If they don't clarify it, this is off the record kind of. Look, if they don't clarify it, go elsewhere, please. Dar al-Ifta al-Misriya, they offer a fatwa service in English. And if you ask them what is the evidence, they will give you part of the reasoning. They will not do the entire research project for you, but they will at least give you the main points of the reasoning that goes into generating that fatwa. Also, big institutes like Dar al-Ifta, they almost always have either large fatawa or research pieces which clarify the reasoning. And many times, if you ask for a question like on brain death, they'll give you the answer, and then they'll tell you which fatwa to go look at for further information. Again, if they're not giving you, if they absolutely refuse to give you their reasoning, please shop elsewhere.
And I would just like to make a comment about the issue that you're going to discuss tomorrow about the brain death. It's a very major and most controversial issue in the medicine today about what is to be, in fact, the definition of death. This is a very controversial issue in the Jewish community, Christianity, and Islam. And we are a little bit lagging behind in trying to make the definition clear. And when this brain death issue was decided as the death, this was almost like 30 years ago when there was a shortage of the organs, and the unified definition of the Death Act, which was passed some years ago and ratified again 2-3 times. According to that, either brain or other is considered one of them is enough. But in actual fact, you need both of them to declare the actual death of the person, which is the oldest criteria. And this brain death criteria has been used only for one purpose, and that is to increase the supply of the organs of the heart, or the other, the body organs for the donation and transplantation. So it's a very touchy, very difficult issue in medical field as when to define death in the philosophical way and in the practical way. And one comment that in relation to the very first question that came up, that when you mentioned that if you want an answer, go do research. I think this is, in my opinion, slightly difficult issue to handle because not everybody is into the research mode, and some information which has a critical impact on the community should be volunteered by the scholars in a little bit simplified version, and more often conferences should be held and disseminate the information rather than having the person to wait for do the research, and that will be only few people can do it. The majority will be still left without the information. So I appreciate if there are more educational meetings to promote the interest of learning.
As far as my answer to the first question, I do apologize if I was so short and abrupt and blunt on that one. Part of the reason that it kind of generated my response is that this is an issue where, yes, there's controversy, and it has been discussed for and against on the internet everywhere. And I'm somewhat shocked that people will Google trivial things and they won't Google this. I mean, on this one, there's really not much of an excuse not to at least know the different types of female genital mutilation. I mean, to ask the question on this and to accuse the ulama of remaining silent on something that clearly is a problem, it kind of ticked me off. All right? And I do apologize. I do apologize for the tone, but I think that anyone who has sat on this side right now has felt that frustration, where the ulama are accused of negligence when they actually have been going at it 24/7, 365 and dealing with these things. I know that Dar al-Iftah, both before Sheikh Ali and before his predecessor, since I think either the 60s or the 70s, they were all involved with the legislation that declared this a criminal act. There's no short history here on the ulama discussing this issue. So, again, I apologize. Please, on Yom al-Qiyamah, don't ask for my flesh from this one.
Just a very, very short addendum. I mean, this is part of what I had in mind in terms of the real need, particularly in Muslim communities, for more literacy, because there has to be a higher degree, even when the ulama speak. Oftentimes, it's like throwing seeds on concrete because there's not the capacity to really intelligently consume what they have to say, and therefore the tendency is to opt for the easy, pat answers. So I think that this whole enterprise of the greater diffusion of literacy is extremely important. And I think that for particularly those of us who live in America, we have the resources, we have the opportunity, we have even the burgeoning infrastructure. I mean, this is something I think that we really need to do a much better job of. Coming generations should be much more religiously literate than past generations, particularly here in America. And I think that this will speak, to some extent at least, to part of the problem that Sheikh Musa is talking about.
And I'm sorry, I just need to add one more. I think what the Sheikh meant by research, he really didn't mean that you go and conduct a scientific research, because that might be beyond the scope of your expertise. I think he meant the research on the internet, for example, which is very affordable and easy these days.
I think we have time for one more question.
Assalamu alaikum. I have a question specifically for Imam Qazwini and Sheikh Faber. I'm a head and neck surgical oncologist here at the university, and so we deal with a lot of terminally ill patients and a lot of end-of-life issues. And I think when we talk about bioethics, we focus a lot on the role of the healthcare provider, but there's also the perspective of the patient as well. So, I mean, each of them have their own specific issues. So in dealing with, let's say, an elderly patient who has a terminal illness, and we know that they're incurable, often when they're admitted to hospital, they're given the option of a DNR, or do not resuscitate, or do not intubate. So if they have cardiac arrest while they're in hospital, if they don't wish to have that done, then they would just be let go peacefully, their own way. So what, according to, given the sanctity of life, and given the Islamic legal framework, is there a role for the concept of autonomy when for Muslim patients to want to die naturally in that kind of case? Is it permissible for Muslim patients to even request a do not resuscitate kind of order request?
From an Islamic Shia perspective, if the patient is a practicing Muslim, he might not be a practicing Muslim, and therefore he will decide for himself. But if he is a practicing Muslim, then he should follow the fatwa, the edict of the scholar he follows, and he believes in his fatwa. So whatever his fatwa is, he has to follow it. Now, I mentioned earlier that the majority of Shia scholars believe that the patient should be put on life support machines, and he should not sign on a paper that indicates his refusal of the life support. But there are a few Shia scholars who believe that it is up to the patient to do that. So it is based on the scholar he follows, and the concept of taqleed, following the scholar on his fatwa, is very common in the Shia tradition. Most Shia practicing people they pick a scholar and they stick to his binding rulings. So it depends on the scholar he is following. If he follows a scholar who permits him, then he can reject the life support. If he follows a scholar who would not permit him, then he cannot.
There's several issues here, and one of the issues is, does the patient have to seek medical treatment? There's another issue, does a care provider have to offer it, even if he's not being asked to do it? There's another issue of, can the care provider actively, how do we put it, quicken the person's death? Now, all of these are the first one, the general answer is no. Someone who's sick does not have to seek treatment. It's not something that is absolutely obligatory for him to do. And there is some difference among the scholars on this one. Very, very common position, he's not required to do it. Does the doctor have to provide? All things being equal, he's supposed to. If the patient, however, says that my life is forfeit, then the doctor would not be held negligent, would not be considered criminally negligent in the Sharia for, how do we put this, assisting in quicker termination of the life. Right? And please keep in mind the things I'm saying here, do not go apply them right now. You need to talk to someone bigger than me to make sure that the situation is right. But it's there. The final thing was the hastening of death. I mentioned there's some mechanisms that might allow it. Right? It's a very, very difficult thing, and I remember when I was talking to Asim about this, I think that a lot of the fuqaha, a lot of the jurists that look at biomedical issues do look at it a little bit too much like in the abstract and don't always recognize the position that an attending physician is put in where they do see the suffering and they do want to know, can we allow the person to die? Can we quicken the death? What's going to happen? These are all complicated, and I know I keep saying let's defer this till tomorrow, but one thing that was on that slide that I showed you of all of those issues was the issue of removing life support system, life support assistance. One of the very common answers among Sunni scholars is that we cannot cause death, that the physician is not supposed to cause death to come faster. He's not supposed to actually actively cause the death. However, they can remove life support system that is the only thing between him and his natural death occurring. But they make it as like, they try to comfort him when he does it. I'm not fully prepared for answering that question. That's for tomorrow, inshallah. But that's all I can give you at the moment. And it's, inshallah, alhamdulillah.